Hi folks, this is Dr. Dan McGrath. I wanted to put something together that was simple and practical for all of you up-and-coming individuals who will be potentially sitting for the oral exam for the ABHRS. First and foremost is you have to know that when you sit down at the table and start the interview, you're going to have a timer on the table, and it's going to be timed at 20 minutes. You have 20 minutes to get through the case, okay? Now, in the past, when we've worked with candidates, one of the things that we seem to run into most commonly is that our candidates taking the examination will many times run out of time. And they run out of time because they start to get get on a side path or get distracted with things that aren't really necessarily related to the case. And there are some key things that we're looking for in every single case. And these things we check them off on our checkboard. And these are very basic things. These are basic things that you should be doing on every patient anyway. It has to do with when we were back in medical school and going through your checklist of the things that you have to ask about in getting a patient history. So I'm just going to touch on some of these things and talk about this and go through this so that you all can make sure that when you're going through, you sit down with your piece of paper and your pen and you start writing these things down and making sure that you've got them checked off. Now, when you come into the examination, you'll have paper and you'll have a pencil. You will not be able to bring anything in, but you'll be able to write on the paper. And I strongly recommend that you write some of these things down even before the case is presented and even before you start the oral exam, so you don't get distracted, you don't get nervous, and you don't get thrown off track, okay? And we're going to talk about this, and it's straightforward and it's basic, all right? You're sitting down, and what do? What's the first thing you're going to ask? Well, basically you're going to go through and you're going to ask about the patient's chief complaint, okay? Abbreviation, CC, chief complaint. What brings them in? What's the problem? Well, doctor, I want more hair. Okay. The next thing is going to be HCC, or the history of the chief complaint. Get a little information about how that all began, okay? Fantastic. Then don't forget, very important, past medical history. You've got to ask the patient, do they have any medical problems or anything that's important that you should know about? Typically, the answer is going to be no. Maybe they may say, oh, I'm a diabetic, or maybe there's something that's pertinent. But just get that out of the way. Then, what else do you go to? You go to past surgical history, okay? Past, PSHX. Past surgical history, okay? Get that out of the way. No surgeries? Great. Next, what about family history? This is the biggest one that we see patients forget. Family history, okay? Extremely important. Review the family history. Mother and father, was there hair loss in the family, etc., etc. Don't leave it out. You'll lose points, okay? Next thing, you want to ask about any medications. Is the patient taking any meds? All right? These are all basic things that we know we have to do when meeting a new patient and discussing issues of any nature with a patient, is to go through all of these basic things, okay? The chief complaint, history of chief complaint, past medical history, past surgical history, family history, medications. Another big one that everybody seems to blow right over and forget, okay? Any allergies? Don't forget to ask about allergies. This is very, very important. And then, again, another important one. Social history. Do you smoke or drink? You've got to ask that. Do you smoke or drink? Now, when you've gotten through the important preliminaries of family history, medications, past medical history, past surgical history, these are all the basics that you should be doing all the time with patients anyway, and you can write those down. It's almost like doing a SOAP note. Well, then you get to a component that we would all think about, and that's review of systems. Don't get bogged down too much in a review of systems like, do you have any pulmonary problems? Do you have any problem breathing? Do you have any chest pains? Just go through the basic complaint and get family history, medications, social history, past medical, past surgical, and don't go too far down the road. Like if the examiner says, yes, well, I have a history of diabetes. Okay, you make a note of that. You might ask, is it insulin dependent? Is it controlled? Is it out of control? Those are pertinent questions. But don't get too sidetracked into getting into any details at that point. So when you're doing your review of systems, try to keep it specified towards the case itself and don't waste too much time going through that. When you're doing your physical examination, of course, this is a mock board exam, so you're going to have anything that you need. And the best way to handle that is to say, well, are there any abnormalities in the physical exam other than what we have talked about? Do you have any abnormalities? No, and the examiner is going to say, no, the physical exam is normal, the blood pressure is, but you're going to have to ask that. What is the patient's blood pressure? Okay, what is their body weight? These are basic things you have to ask because a lot of times they're not going to give it to you unless you ask. So, what are the patient's vital signs? The examiner will say the vital signs are normal. Okay. What is the patient's blood pressure? Blood pressure is normal. Okay. So don't get sidetracked onto minuscule things like that. What you want to do is get into getting out of the way those basics that I reviewed with you. Allergies, family history, medications, okay? Social history. Don't forget those things. Get them out of the way quickly so we can check them off our paper, and then you can move on to the bulk of the case. All right? Now, as a general rule of thumb, when we're doing these cases, these aren't tricky cases. We're not trying to make it a trick question, okay? You're going to see a patient that's going to have a particular hair loss pattern. Sometimes it's just a male pattern, androgenetic alopecia. Sometimes there may be a specific type of hair loss issue. Sometimes there may be a patient that's got maybe a scarring alopecia or something unusual. Understand that when you're doing this examination, they're only going to give you the information that you ask for. Okay, so if you're not sure, you say, listen, I want a scalp biopsy. What does the scalp biopsy show? Make sure you ask for that. If you don't ask for that, they're not going to give it to you. It's not going to be spontaneous. So whatever you want, you have to ask for it. If you ask for it, they'll give you the answer. If you get stuck and you're not sure, is this some kind of trick? Say, I'd like a scalp biopsy. Okay, scalp biopsy is normal. Okay, good. You've ruled a lot of things out. But I'm telling you, the vast majority of these cases are not meant to be tricky. They're just meant to see if you can assess a normal, healthy patient that comes in that wants a hair transplant, and how many grafts would you recommend? What type of, surgical approach would you recommend? What are the options? Follicular unit extraction versus strip excision versus follicular unit transplantation. What are the differences? Make sure you know the differences. These are basic things that you should know if you're going to be doing hair transplant. Why would one patient do one type of surgery versus another? You want to be able to explain that, okay? And you think 20 minutes is a long time, but it goes by fast. That's why I give you that list with the chalkboard initially. Get those things out of the way in the first minute of your exam. History of chief complaint, past medical history, past surgical history, okay? Medications, allergies, family history. All of those things that are basic tenets of a good physical exam, get those out of the way so we're not sitting there at the end and realizing that you never asked about family history, you never asked about patients' medications, and we end up marking off points because of that. Get the easy stuff out of the way, ask those questions right away, and then you can get into saying, okay, physical exam. And when you get to the physical exam, we're going to show you pictures of your case. And then if you have any questions, you're going to ask us, and we're going to answer that. But this is not meant to be tricky, okay? I remember when I went through my examination, I had a patient while I was working on them that the examiner said that the patient was starting to get, sweaty and lightheaded and getting a little dizzy. Well, don't get nervous. Do what you would normally do. If you're examining a patient and you're working on them and they say that they don't feel well or they feel a little lightheaded, or you notice that they're getting a little sweaty on their forehead, what's the first thing you're going to do? You're going to lie them down flat so they don't pass out on you. You're going to get them some supplemental oxygen. You're going to check some vital signs. You're going to institute a normal protocol for taking care of your patients like you would anyway. Okay? Is the patient nervous? Are they having a vasovagal effect? Are they having a little bit of low blood sugar because they didn't eat breakfast that day? These are the sort of things, if anything gets thrown at you, it's going to be basic stuff like, can you recognize that somebody's having a vasovagal episode versus a hypoglycemic episode, and how do you handle it? Okay? We're not going to throw weird things at you and all of a sudden have the patient go into cardiac arrest. I mean, it's just, that's not normal. You may have an examiner query you and question you about understanding and recognizing somebody that might be having a reaction to lidocaine. You need to understand and know what are the signs and symptoms of lidocaine or any of the anesthetic side effects. How do they manifest themselves with unusual taste in the mouth, and then muscular fasciculations, palpitations, and then progression of that. So it's probably good to brush up on recognizing the side effects of lidocaine toxicity and how do you handle it. Okay, those aren't very complex things. They're obviously things that you should know going into the examination anyway. And I'm not saying that that's on the oral exam, but that's about the most complicated thing you'd see. What we want to see is, do you understand as an examinee how to handle the average patient who comes in? How many grafts would you recommend? What surface area would you recommend it? And how would you put the case together? How would you put together a surgical solution for a patient that's coming in for hair transplant consultation? Now, this whole review that I just did with you, it took me a little over 12 minutes, okay? And that shows you how quick the time can go by. So my greatest recommendation to you again is, and here's my little paper for review, go through those things, guys and gals. Get the history of chief complaint, past medical history, past surgical history, family history, medications, allergies, social history, meaning do you smoke or drink? Get all of those things out of the way quickly. And if you do that, it'll make it a lot easier for you as you go through the exam. You might even practice writing those things down as soon as you sit down at the table and you're introducing yourself to the examiners. Write those things down so you don't forget one of them, because you're going to be nervous. Write them down so you can ask them. What is the history of the chief complaint? How long has this hair loss? Doctor, I've been losing my hair. How long has this been going on? Oh, this has been going on about 10 years. Okay. Do you have any medical problems? No. Do you have any surgical history? No. You use any medications? No. Do you smoke or drink? No. Does your family history have any problems or history of hair loss? Is there any significant family history related to this particular condition? Answer is no. Both my parents have all their hair. Okay. Get these simple things out of the way quick. That way you have more time to focus on the case and be able to disseminate a good, logical game plan for that patient who's looking for your expert recommendation when it comes to hair restoration surgery. I hope that's helpful. Again, it's Dr. Dan McGrath. If you need or have any questions and I can do anything to help you in preparation, I'll be there during the week of the examination and will be one of the examiners as well. And you can, of course, reach me through the ABHRS, and I'll be happy to answer any questions and help you any way I can.